Hello everyone, myself Dr. Priyanka and I'm one of your mentors for study MRCPI. We are back today with the YouTube series and here we will be discussing the most important modules and the most important topics, the frequently asked questions in the respective modules. So today we will be discussing on the FSRH, that is Faculty of Sexual and Reproductive Health module. So do like, share, and subscribe Study Medic channel, and also press the bell button icon to get updates on recently added videos. So always remember that ambition is the path to success and the persistence is the vehicle that you arrive in. So keep practicing. So let's start. So here is a 22-year-old woman. She presents to her GP for advice regarding the most appropriate postnatal contraception. So she had uncomplicated vaginal delivery 6 weeks back, and it was a full-term normal delivery. But she is intermittently breastfeeding and bottle feeding. She is mixed feeding her baby, and she and her partner are keen to space out childbearing by 2 to 3 years. That is, they want some long-term contraception and requesting for the same mode of contraception. But she admits to have difficulty in remembering to take contraceptive options, medications. So, what's the single most appropriate contraceptive option for this woman regarding her scenario? So coming to each one by one. So here she has already delivered 6 weeks back, and she's breastfeeding, she's mixed feeding the baby, and also they want some method which is long acting, and she has a difficulty in remembering. So if she has difficulty in remembering, we can just rule out one by one that condoms or a contraceptive combined oral contraceptive pills might be difficult in her case situation if she fails to remember. Even the vaginal ring also, and lactational amenorrhea is not reliable in her case as she is mixed feeding, as she is intermittently breastfeeding and bottle feeding the baby. Also, condoms we know are not a long-term method of contraception, but they can definitely prevent for STIs. But here, considering this scenario, the best option here is to give progesterone only implant. That is option E, because it's a long term, long acting reversible contraception, so that after 2 to 3 years she can again start for childbearing, and it's again like there is no need to remember, so it can come in for 3 years. So and she is mixed bottle feeding, so there is no harm on the lactation. So this is the best option. So the progesterone only implant is called as the Nexplanon. It contains 68 milligrams of etonorgestrel, and the duration of action is for 3 years once it is placed. So it's the most effective known long-acting reversible method of contraception, which has a failure rate of less than 1 in 1,000 over 3 years. So that's the answer. Now, the second scenario here is a 22-year-old woman who presents to the GP for advice regarding the most suitable postnatal contraception. So she had delivery 3 weeks back, and it was a full-term normal delivery. She is completely bottle feeding her baby, and she and her partner want to space out childbearing by 1 to 2 years, and they want a reliable method. And but she has a history of irregular menstrual cycles and also history of polycystic ovarian syndrome, that is PCOS. So what's the single most appropriate contraceptive option in her case? So if we want to rule out here, uh, she has a history of irregular menstrual cycles. So copper T, that is copper intrauterine device, or progesterone containing contraception like levonorgestrel, or progesterone only pill or progesterone only injectable, they have a side effect of causing irregular menstrual bleeding initially, which most of the patients after few months will discontinue the method of contraception because the bleeding is very erratic. So that is the side effect of progesterone only contraception. So the combined oral contraceptive pill, that is COCP option A, will also help in her uh, regularize her cycles and also PCOS. And she is bottle feeding her baby, so it won't because COCPs have effect on the breast milk, but she is bottle feeding, so that's the best method of contraception for this patient. So yes, she is not breastfeeding, so it won't affect the breast milk. It won't affect in her case, and that's the she's already more than 3 weeks postpartum, so she can have that. So here's in the third scenario, there is a 26 years old woman who has come for contraceptive advice, and she has decided to start on COCPs, that is the combined oral contraceptive pills. But you have to advise her the best method on using this pill. So what is the best method to how to use this method so there is less failure rate? Okay. So following of the following statements, statement is incorrect? Okay, that you have to take. So which is incorrect? So first is, if you start the pill on the first day of your period, that is day one of the period, you will be protected from pregnancy immediately. So yes, if it is started from day one of period, so the chance of pregnancy is very less, as the chance of egg release is very less in at this point of time, and there is no need of any additional contraception. It is started from day 1 to day 5. If you start the pill, so this option is a correct advice. So if you start the pill at any other time in your menstrual cycle, you will need to use additional contraception such as condoms for the first 7 days of pill taking. So even this advice is correct, because if it is taken from any other day other than the day 1 to 5, then they need to practice additional contraception for 7 days. The third advice, that if you miss one pill anywhere in your pack or start the new pack one day late, you will need to use additional contraception such as condoms for the first 7 days of life of pill taking. So this is the incorrect advice. This is the correct answer, because if any one pill is missed, if you can see here on the missed pill taking, so if only one pill is missed, so there is no need of an emergency contraception that is required. Okay, no need of additional or an emergency contraception. If one pill is missed, that pill needs to be taken as soon as possible, the missed pill. That is the correct answer. The fourth option is, you can also start the pill up to and including the 5th day of your period, and you will be protected from pregnancy immediately. So as I said, if they have taken from day 1 to 5, so they have taken the pill, so the pregnancy, they are protected from the pregnancy immediately, and there is no need of any additional contraception. And you can start the pill anytime in your menstrual cycle if you are sure that you are not pregnant. So this advice is also correct. So the incorrect advice is advice number C. So the next question is, which one of the following is characteristically associated with the use of progesterone only pill contraceptive? That is the one contraceptive options which have only progesterone only pill. Okay. So here, the correct option here is option E. That is, if we give progesterone only pill contraceptive, so there is increase, it has a side effect of causing erratic menstrual cycles and uh, erratic bleeding. But this bleeding, the menstrual irregularities tend to resolve if the patient is taking the pill for a long period of time. So the bleeding patterns are most common. That is the most common reason of stopping the POPs. And here, almost out of 100 women, 70% of those will report breakthrough bleeding or spotting in one or more cycles. So that's the reason after 1 year, almost 10 to 25% of women who are using POPs will discontinue the treatment. And those who are using, so almost 20% will be amenorrheic, and 40% will later have like regular bleeding. 40% of them will have erratic bleeding. So the next question is, which one of the following is appropriate when counseling a woman who is requesting emergency contraception following unprotected sexual intercourse? So what is the correct answer? Which advice is appropriate that we have to choose? So copper IUCD insertion is effective provided it is no more than 5 days after known ovulation. So yes, so this advice is correct. That is, it is the right answer, because we know there are three emergency contraceptives available. That is, one is copper IUCD, which is most effective, considered as most effective, and other two are the oral ones. That is the levonorgestrel add the ulipristal acetate. So these are the oral ones, and copper IUCD. So it can be started up to 120 hours, that is 5 days from the date of ovulation. And ulipristal acetate also can be started up to 120 hours, that is 5 days. And levonorgestrel is licensed up to 72 hours. So no oral medication exists if 72 hours have elapsed from unprotected intercourse is wrong, because ulipristal acetate can be taken up to 120 hours. Option C is no emergency contraception is available over the counter without a prescription is wrong, because it is available without a prescription. Option D is tablet methods are more effective than copper IUCD. No, the most effective emergency contraceptive is copper IUCD in preventing a pregnancy. And then followed by ulipristal, and then the least effective is the out of the three is levonorgestrel. Ulipristal is a prostaglandin that is effective if taken within 120 hours. So it is a anti-progestrogen. Okay. That is effective within 120 hours. So here the correct option is answer A. That is, if copper IUCD is taken within 5 days of expected ovulation, then it has a least failure rate of the rest two. Okay. Yeah. So I hope guys this task helps, and thank you so much for attending.